This is Progress Canada. Today we're joined by two guests, vaccine and public health parent advocate Jill Promoli and Dr. Adil Shamji, Ontario Liberal MPP and critic for urgent care and public health. In this episode, we'll tackle the current measles outbreak, the spread of vaccine disinformation, and what's needed to rebuild trust and readiness in Ontario's public health system. First, we'll begin with Jill. Thanks for joining me.
Thanks for having me.
Okay, so we're talking to each other in the midst of a measles outbreak that's largely impacting children. So this week also marks a tragic anniversary in your own life that led to your work as a vaccine and public health advocate. Can you talk a little bit about your story to start us off?
Yeah, so this is unfortunately the story that literally no parent wants to have. I'm part of the worst club on earth. So 9 years ago, on May 6th, we lost one of our kids to a school flu outbreak, and his name was Jude, and he'd been a perfectly healthy, very happy little kid, and he was just a little over 2 years old, and it was actually his older sister who had been in kindergarten at the time, and what they'd been calling a nasty bug had gone through the classroom, and before we knew that that she had gotten sick, it had already gone through essentially the entire class, and when we got the call that she had come down with a fever at school, they told us that that essentially everyone had been through it, and some of the kids had actually been hospitalized, and some of them had been out for weeks. So it was, I don't know, this is something that's not so uncommon with kids. Like, we know that kids get sick all the time. This one seemed particularly rough. For Isla, she was better within 24 hours, and so we were pretty relieved considering how rough it was for some kids. But we kept her home for a few days, knowing how serious it had been for some kids. And later that week on May 6th, Jude woke up with a low-grade fever. Now, Isla was back to school at this point. But considering how mild it was for Isla, we weren't terribly concerned. And Jude seemed pretty okay. He was laughing, he was playing. When I put Jude and his twin brother down for their afternoon nap, everything was, business as usual. And when I went to go wake the boys up to go pick up Isla from the school bus, Thomas was up and laughing and Jude wasn't. And this was unusual because one little boy would always wake up the other. And I could tell very quickly that Jude was not okay. And Jude had actually died during his afternoon nap that day. It took a little time for them, several months actually, to determine the exact cause of death, because it just wasn't obvious. Nobody was looking for the flu so late in the season. But they told me, they're like, there's nothing wrong with this child except that he's not alive anymore. And it was finally the pathology that came back that confirmed it was influenza B, and it had stopped his heart while he was sleeping. And it's not the typical outcome of the flu. People get the flu all the time, but we do know it's something that does unfortunately cost more lives than I think we realize. We think about it, cold and flu season, it's something that's miserable and then you get better. And for most people, that's the case. But there are too many people, unfortunately, who experience the most severe outcomes of some of these preventable diseases. And unfortunately, we are in that small percentage of people who paid the highest price.
I will say, since learning your story, I used to get the flu shot, periodically. I'm an asthmatic, it makes sense for me to get it all the time. But, having a sick grandparent or something like that, I would get it at those times. Ever since hearing your story, I get it every year. And I get literally every vaccine I possibly can because, why not? And I think what your story highlights too is that a lot of people think they're invincible, or that their family members are invincible, and then if you feel generally healthy, I'm probably a bit of a hypochondriac, but if you feel generally healthy, most people don't see the need to take extra precautions. Mm-hmm. That may be well and good, but ultimately there are other people who may be impacted that you see. We talk about people who are immunocompromised. We talk about people who have other health complications that, you don't know them when you're passing them on the street. So what I think about with your story is how late you were informed about the outbreak, even in the school, because this is something, I've got young nephews now who illness rips through school and daycare all the time, but sometimes it takes a really long time for parents to find out about it. So I want to pivot now to vaccine hesitancy, public health hesitancy, and, the parents' role, because we talk about disinformation, and the danger is that we frequently will just call people an anti-vaxxer if they are hesitant about something, whether it's for themselves or their kids. We automatically go to there in our heads. I think the pandemic amplified some of that, because there was very much an us versus them environment that was created. But that's dangerous as well, because,
I
as
agree.
yelling at people is not usually the best way to convince them to do something, regardless of what that thing is.
Yeah.
So, sometimes people are really well-meaning when they believe and spread disinformation, and it's not because they are trying to create problems, or because, they are just mean-spirited. It's just because it's something that has come into their sphere of influence and they've believed it. That leads to a lot of further communication about where people can find actual accurate and good information, as a parent, about, public health measures or vaccine information or whatever the thing is. So, in your experience as an advocate and as a parent who has, dealt with the fallout of these kinds of pieces of disinformation, what's the best way to combat disinformation and educate people on the resources that are actually available to them and their families?
Yeah, no, you touched on a lot of things here, and I think you've got it just right. Like, it is challenging because we do find that there are different challenges when it comes to having these conversations about public health and dealing with preventable illness, and specifically when it comes to vaccination, because there is so much misinformation and disinformation out there. I think it's important to remember that, you know, people who are choosing not to vaccinate, they're not a monolith. We've got one very small group of people who are just never going to vaccinate. They've made that decision. There will never be any convincing them, and there's no value in engaging in, aggressive arguments when people have sort of decided that that's the way that they want to go. And I think it's important to recognize that there is that segment, and making sure that, if that's the decision people have made, doing what you can to ensure that they have the information that they need within what they're comfortable with, to try and protect themselves and people around them, and also put tools in place, for example, paid sick days, to make sure that people do have that opportunity to stay home if they are sick, so that they're not passing things on if they've made that decision not to vaccinate. There is a larger group, who we would call vaccine hesitant, as opposed to vaccine refusers. And that's a group of people who are more likely to be either behind on vaccination or just not quite sure about it. And what we want to be doing is making sure that we're finding better ways to get them the information that they need to make the best choice that they can, to protect themselves, their children, and our communities as a whole. Because when we make the decisions about whether or not we're going to get a vaccine or vaccinate our children, we're not just making that decision for ourselves. We're making that decision for everybody that we come in contact with, and everyone that those people will come in contact with after. So it affects our classrooms, it affects our workplaces, our communities, our healthcare system, which is so overburdened right now. And so this is something that's not just about, like, okay, well, there's a certain number of people are sick. It's something that's about, okay, how well do our communities as a whole function if we fail to deal with this? But we have to make sure that we're moving forward with respect and compassion, and understanding that people are like legitimately hesitant. It's not that people are being malicious in the decision that they're making. It's that they are unsure about the right way to go. And often when people don't know, the action is inaction, right? And so helping them get that information so that they can feel confident in the decision that they make to protect their family. That's the best thing that you can do. But I always say, like, there's no value in shame in these conversations, because you're not going to shame somebody into coming over to your side. You're just going to push them further away. And I think that there's a lot of sometimes these conversations become so divided, and what we want to do instead is make sure that we're inviting people in, making sure that they understand that, if you've got concerns, it's okay to have concerns, it's okay to have questions, but we just want to make sure people know that, it's important to get good quality information and answers, because their health is worth it, and our public community health is worth it too. So it doesn't help to make someone feel stupid or like they're awful people. It's more important just to make sure that they're heard and that we can find ways to, treat each other with respect and do what we can to bring people along with us if they're comfortable with having that conversation, and make it so that more people do feel like they can engage in that conversation.
So an aspect of that is, I come from the communications world where we talk about trusted sources, and, that's important in public health, of course, but sometimes we mistake what a trusted source is to people. So
Mhm.
when you look at what motivates people to buy a product, if there are publicly posted reviews, even from strangers, but because they are personalized, people tend to believe those more and are more willing to buy into whatever the thing is.
Mhm.
Your campaign around the flu that you do every year very specifically mentions Jude. It's for Jude for everyone.
Mhm.
Can you talk about the importance of those interpersonal relationships in getting people comfortable with some of these ideas and getting them to the place they need to be to actually hear these public health messages?
Yeah, absolutely. So we lost Jude in the spring of 2016, and when we first learned the information about why we'd lost him, that it was the flu. And I had so many questions because I was confused. To me, it just didn't make any sense because I had always understood that the flu would look like something a lot more serious if it was going to become something that was deadly. And instead it was just it was so fast, and I didn't understand it. And I just thought, okay, well, I feel like I'm pretty informed when it comes to public health, and I don't fully understand what has happened here. And if we're going to share with the people in our lives what has happened to Jude, we're going to have to be able to answer these questions too. And if we have these questions, then a lot of other people are going to wonder too. So for us, it was about making sure that we would be able to have that conversation in a helpful way, but we also wanted to make sure that we weren't going to um, push people further away from public health measures by learning Jude's story. And for clarity, um, Jude was vaccinated against the flu. And I think this is something that's really important to pay attention to also, is that, vaccines save a lot of lives and do a lot of good. But no vaccine is a guarantee, and we know this. Like the measles vaccine is about 97% effective with both doses. So it's the gold standard in vaccines. So when we know that we have a lot of people who are vaccinated against measles, we simply just don't see measles circulating. The flu is a little bit tougher because it's not a stable virus. So that's why we have to get a new flu shot each year, because the flu is different every year. And so it's unlikely that you get vaccinated and still die from the flu, but it does happen to a very tiny percentage of people. We're just in that really, really small percentage of bad luck. But we needed people to be able to understand that messaging and come along with us in the conversation. But that's what made it really tricky. So I wanted to make sure that I was understanding things properly so that I could talk properly with others about it, because I also had a feeling the story would start to travel once we started sharing it too. So I started talking first to our coroner, because suddenly we had a coroner, and then to family doctors and to our pediatrician and to nurses and anybody who had time for me. And then, infectious disease experts, anyone who had time to talk to me about this, just to make sure that I could understand it in a way that I could explain it, because I'm not a medical expert. I think I've gained a certain amount of expertise in these years, unfortunately, just through living through this. But I needed to be able to explain it in a way that it would make sense to other lay people like me. Because I think a lot of these things, when we talk about health, it makes sense to other people who are in that field, but that can be a lot harder if you're just a normal person on the street and you're listening to it and trying to wrap your head around it. And so I kept thinking, like, okay, well, when we finally update people on what has happened here, we can just post it on our Facebook page and then like that's it. But I feel like we need to take more control of this messaging and see if we can do a little bit more to hopefully prevent this from happening to somebody else. And the more that Craig and I talked about it, we thought, okay, well, if we could share this a little bit more widely, what if we can help prevent somebody else from losing their life or their loved one this year? And we thought, okay, this is really fast because we've been through a lot this year, but we also really don't want somebody else to die if we can help prevent it. So we kind of thought about, okay, how can we talk about this in a way that's going to resonate? And when speaking with all these experts, I asked, like when I learned more about how many people die from the flu in Canada every year, I was shocked. It's about twice as many people dying from flu as die from car accidents in this country. And to me, that just blew me away. And I asked,
Yeah.
like, why don't we pay more attention to that when it's so many deaths? And I thought, what if we shared to Jude specifically? Like, would that help? And I heard over and over again, they're like, yes, because people kind of other it. They aren't able to personalize it and put it into context. And so talking with experts, they said, yeah, we think it would help if people understood that this is a real person that this happened to, and it can happen to anybody. And that was a bit of a tough thing for us to overcome because surprise, we're actually pretty private people. And I've had to get over that a lot over the last number of years. But we had to learn how to set that aside because all we could think was we wish somebody could have done something to prevent this for us. And if we can find a way to prevent this from happening to somebody else, we have to. Like, we just have to. And so we figured out ways that we could hopefully put out messaging in a way that would reach people who were like us, just other families, other parents, anyone who was out there who had somebody who they loved, who they wanted to keep safe. And like we've been very careful about getting the flu shot for many years because we had, loved ones in our lives who had different health challenges. And so it was something we were just in the habit of doing. But again, it's not a guarantee, but the more people who get the flu shot, the less flu that we have. And a stat that really stuck with me was, 35% of Ontarians getting the flu shot reduced cases by 61%. So what if, 50% or 75% of people are getting flu shots? Can you imagine how little flu we would have circulating and what a difference it would make in slowing down the way that it changes in our
Exactly.
community?
A moment ago, you talked about, the folks who can't be reached, won't be reached, and that they've made their decision, and that's that.
Mm.
And obviously, that's their decision, bodily autonomy, all those kinds of things. There's a different group of people who have made that decision and are very vocal that everyone else should make that same decision.
Mhm.
Many of these people, are active, willing, enthusiastic participants in spreading disinformation. Sometimes they even border on hateful rhetoric. There's a level of, I've worked in politics, there's a level of dismissiveness I can have for that, where I'm like, okay, sure. But, the average person who cares about these issues and wants to talk about them and wants to be an advocate, that can be really, really rough. You've gone through years of it. You posted a tweet today about a Toronto public health meeting you had in 2019, which again is pre-pandemic, like convoy, pre all this stuff,
Mhm.
ramping up in Canada, where people said some really, really hateful things to you. And I'd never heard that story before. Can you talk a little bit about that? And also, given these baseless attacks that are always directed at you as an advocate, what keeps you going? How do you deal with that kind of rhetoric from people?
Yeah, honestly, that was a tough meeting. And it so they were making a decision in Toronto about putting together a strategy to tackle vaccine hesitancy and try to improve confidence. And I was so glad they were doing that. And so I was asked to come in to delegate, and there were a lot of people delegating that day. There were 4 people who were delegating in favor of a strategy to improve confidence, and I think 27 against. And so it was a long, rough meeting. The
Wow.
gallery was full. They had an overflow gallery outside. Inside, you weren't allowed to like yell, but outside there was a lot of yelling, and we could hear it inside the room. Um, it was,
I was going to say, for those who don't know the shape of that meeting room, like it's a big dome that people can stand directly under outside. So
yeah,
I can
yeah.
imagine the noise that would have come in.
Yeah, and while I was delegating, there were people like standing and sitting like right behind me and like kind of all around me, and it was an interesting situation. It was like being in a room with my inbox, which was a little bit intimidating because I had been,
Horrifying.
yeah, well, I'd been advocating for several years at this point, and I feel like the space has changed a little bit because, for several years, there would be times that I couldn't even really use my phone because the notifications would just not stop. There was just so much horrific content that was coming my way constantly. And it was a real challenge. I think we're in a tough spot again now when it comes to social media platforms, but it hasn't sort of gotten to the same fever pitch as we were dealing with for a number of years there. But it was hard. I mean, to the point that there were multiple news outlets that were doing stories on my inbox because it was just getting so aggressive and sometimes violent the way that it was coming in. And I'm like, this is wild. But it's hard. And it was also, it was hard listening to a lot of those stories too, because I think there's a lot of people who feel very passionate about their position, and you never want to be disrespectful to people, even when they're really saying awful things to you. It's just, I always understand that people are coming from a place of whatever they have been through in their lives too. And I'm not going to be able to change that. I can't change what they have gone through. I can't change what they feel has been an experience that they have been through. And I'm not going to try to do that. But I think for me, all I could think was, there's some really awful things that are being said here, some awful things that were getting done. But none of that was worse than the fact that we had already lost our child to the flu. And so they could say what they wanted, but they couldn't hurt me more than that, because there's a whole person who's
Right.
missing from our home and our lives for the rest of our lives. And we can't fix that. And nothing they can say can change that. He's just gone. And I just don't want that for anybody else. Oh, there was a quote that came up the other day. If you don't stick to your values when times are hard, then they're not your values. They're just hobbies. It was something like that.
Right.
And
Yeah.
I needed it that day. And it was about something else that was happening. I was like, yes, thank you. Like that's a good reminder. That like, even when these things are really, really hard, like we fight for them because they're important. And I don't know. It's going to be hard for a little while, but that's why it's so important when we do see these very enthusiastic efforts that are coming through to work against public health, that we have, uh, I don't know, basic efforts coming through from our own public health authorities and our governments, that something that says, hey guys, maybe you should get a shot. Like, I don't know, like the something, like, I don't know why it has been so silent. I don't know why I'm talking more about measles than our Minister of Health is, but I guess
Right.
that's where we are right now. And I would just like to see them take this on a little bit more proactively, because this isn't new. I mean, that Board of Health meeting was in 2019, and they'd been in government since 2018. We already knew that there was a growing issue at that point. And look where we are now. Now we've been through a lot as a global community in these years since then. But that's why it's all the more important that we're doing what we can to make sure that people do have the information that they need. And still, always with compassion and respect, recognizing that we won't be able to bring everybody with us, but we can do everything that we can to make sure that people have the information that they need, and that they have a trusted, reliable source that they can go to. Because the two most important tools that we have in public health are information and trust. And if we are failing to employ those everywhere that we can, then we're just letting people down.
That gap in leadership that we're seeing from our governments right now, I think it perhaps inspires more of us to actually speak up and get involved in these issues and push our governments to actually take action. Um, as we close off here, what advice would you give our listeners who want to push back against disinformation in general, and then also advocate for stronger public health protections, even when the leadership that should be falls down on the job?
That's a good question. I think sometimes we underestimate how much we can do in our own little corners, right? So like it can be really overwhelming when we see how big this problem is. Um, we don't all have to fix the whole problem, and we're not all going to be able to fix the whole problem. Like we really do need our leaders to step up to that. I think it is helpful to make sure that we are pushing back where we can. If you've got a line into your local MPP, do that. And we can all do that. We can all send an email. We can all make a phone call to the office and just say, hey, like, this is a problem. Um, and same to our federal members, because they can also be supporting public health measures, right? But don't underestimate the importance of speaking about these things, even in your own circles. If you know someone who is unsure about these things, just have a kind conversation with them. And just again, remembering that like you're not going to change someone's mind by making them feel bad, but you can help somebody feel more comfortable in making a decision just by having a conversation with them. Share a story. If you see that something that resonates with you, somebody's story about maybe if somebody else has been struggling with whether or not to vaccinate, share that story and say, hey, this is something that I saw that I think is interesting or whatever. Like stories help a lot because I think it helps other people put it into context and say, okay, I can relate to that too. So share stories, talk to people, hear people out. And if they're just trying to make up their mind about something, encourage them to keep having that conversation. And also always encourage people to reach out to their family doctor if they have one, a nurse practitioner, or if they're like millions of Ontarians who don't have a family doctor right now, they can also go to a walk-in clinic for this information or reach out to their local public health unit. But it just help them make sure that they are getting reliable information, and it shouldn't be coming from like Aunt Jenny on Facebook, because unless Aunt Jenny is like a public health expert, then okay, talk to
Maybe.
her. Yeah, actually try and get good information, and don't believe something just because somebody tells you. Try and seek it out from someone who's more reliable.
I think that's a great place to end on. Thanks for joining me today, Jill.
Oh, thank you for having me and having this very important conversation right now.
So, we're chatting today on the heels of some provincial announcements around healthcare, and also, a continuingly increasing outbreak of measles in the province. In fact, I think it's the largest outbreak of measles in several decades. It might be even more than that. This was, an illness that was very much on the decline, almost eradicated in the early 2000s. And now here we are with a huge outbreak, not just in Ontario. There's a number of hotspots around the world, but Ontario is a leading hotspot. Something that came up today, the Minister of Health stood up and was talking about, getting a physician for everybody, improvements to healthcare, yada, yada, yada. The pandemic led to an interruption, let's say, in the childhood vaccine schedule. Is that playing a role here? Is this maybe just, some people are tracking behind? Did the government have some work to do on that front? Or is this, something else entirely?
I mean, one of the major drivers right now for the measles outbreak that we face is the fact that so many people are unvaccinated. And there are many factors to that. One of the things that I constantly try and push back on is this perception that we're in the situation that we're in because of one or two particular religious minorities or communities. And while I acknowledge the fact that that is one element to this, the fact that there are tens of thousands of kids who are behind on their vaccinations because, fairly because of the pandemic and, perhaps having had to switch to virtual visits instead of in person, but also because 2.5 million people don't have a family doctor in our province. We've seen massive attrition in primary care professionals, in nurses, nurse practitioners. And under any other circumstance in the situation that we're in, public health units and professionals would step up with catch-up vaccination programs, would launch health promotion campaigns, would have vaccination clinics. That isn't happening anymore. And that is partially because of COVID-19, but it's, frankly, due to a lack of leadership, ambition, and prioritization by this government.
I want to latch onto something there, which is there's a tendency to blame specific groups when outbreaks happen. This is not like a new phenomenon. This has happened throughout the history of the world. There's always groups blamed for this. Now, in this case, the outbreak has been tied to a meeting of Mennonites in New Brunswick, I believe, and that's, as people have traveled back to their communities, that's spread. But this doesn't, something like this, an outbreak like this doesn't happen unless there is already an unvaccinated population. So 90% of Ontario's measles cases are in unvaccinated children. There is clearly vaccine hesitancy in the province, and rates are declining in relation to that. So it's not just even complacency. We know that there's also disinformation behind this. Of the widespread use of the internet increasing over the last 20 years, we also have the growing disinformation alongside it. So, you're a doctor, and you're also the public health critic for the Ontario Liberal Party as well. So how should the province, and all of us really, as people who care about these issues, be responding to this crisis of trust in the province?
I'd like to point out that outbreak, as of the last time I checked, in New Brunswick no longer exists. And those members moved to other provinces in our country, such as Quebec, that briefly had an outbreak and no longer have an outbreak. Specifically your question, how do we address misinformation and disinformation? It is ultimately a question of trust. Now, the reality is that many people already trust their doctors. And what people are looking for is calm, rational, reasonable conversations about what is happening in our province right now. We need to have updates about measles, about the scale of the outbreak that we face right now, the reasons about why we face it, and how people can keep themselves safe. And the reality is, I know parents who, the moment their child coughs, are on Google searching measles to see whether their child could have this new, previously eradicated infectious disease. So if we want to inspire trust, we need to start by having open, candid conversations, which are not happening right now. I believe as of today, which is May 7th, we have for the first time heard the Premier utter the word measles in recent memory. We need to see leadership. People need to know that it's okay to talk about measles, to ask about measles, and to have these conversations. And once we're having these conversations, once we have the Minister of Health, the Chief Medical Officer of Health, the Premier, talking about the importance of vaccination, the effectiveness of vaccination, the safety of vaccination, and ideally, the widespread availability of vaccination, which I would argue we're not there yet because this government isn't taking that part seriously. But once we can have those conversations, we're not going to get everyone who isn't vaccinated. I know that because there are genuine vaccine skeptics, vaccine hesitant, and people who are under the influence of very significant vaccine mis and disinformation. But we will get many of those people. And one of the most common questions that I get asked, or that I've been getting asked recently, is should we impose mandatory vaccination? And I'm a firm believer that most people, patients and parents, want to make the right decision for themselves. They want what is best for their children and their families. Right now, they are not hearing what that is. But equipped with the right information, the right knowledge and statistics, they will make that decision for themselves. And based off of over a decade of clinical experience, I know that these calm, reasonable conversations can make a clear recommendation can make a dramatic and profound impact on our rates of vaccination here in Ontario.
So something else you brought up again was, the fact that we have a chief medical officer of health, we have a premier, we have a minister of health, all people who could be showing a great deal of leadership by talking about what's going on and explaining to people where they can go get, vaccine information, et cetera, et cetera. This is something we saw during the pandemic. Doug Ford was out there every day. He had the media in front of him every day. And, the prime minister was doing the same. Across the country, we had political leaders and, the bureaucracy that supports them actually out there doing this work of public health. That's completely absent here. You said just a few moments ago that this is the first time Doug Ford has said the word measles. And it triggered something in my head of during the pandemic, then Minister of Health, Christine Elliott, I don't recall her ever mentioning a single COVID death, a person who had died from COVID at any point during the pandemic. And that, unfortunately, is a reality of a public health crisis. And, I'm feeling deja vu with the measles of just avoiding the topic because it's uncomfortable. Now, again, during the pandemic, they were out there every day actually doing that work, but they were ignoring a severe element of that, which was people were dying. And here we are again, where there's an outbreak happening, but this time, they're almost invisible. So how important is it for, political figures like that, like yourself as well, to be out there actually talking about this?
I mean, for a government that has made its signature slogan, protect Ontario.
Yep.
Now is the time to protect Ontario. People are looking for all of us to do that. And it's why you'll hear me talk about and share as much information as I can about measles and push the government to do as much as it can to prevent measles. And the reality is, it is shocking to me, but one place where we can look that is also struggling with measles, but is actually making a concerted effort, is the province of Alberta, led by a, at best, vaccine skeptical, ultra conservative premier, and at worst, an actual anti-vax premier. But they are doing measles hotlines, public vaccination clinics, new television ad campaigns. Here in Ontario, we have a government that didn't have a problem telling us all of the work that they were doing to make Ontario more affordable prior to the last election. Spent tens of millions of dollars in ads doing that, but can't do anything except for some pretty paltry Instagram ads. In the face of what is an outbreak that really shouldn't exist.
So something I want to ask about is the world of disinformation is huge. It is so large that sometimes it feels like, how can we ever even stop it? I think, when I'm doom scrolling and stuff like that, I'm looking at the internet and thinking, oh God, like, how are we actually ever going to stop these things? How are we going to protect our elections in the future? Like, the scope of it, the scale of it is just enormous. Given that, what can public health do to actually push back against, our fractured information ecosystem? People are getting their news from all different places now. It's not like you can just put an ad in the Toronto Star and then there it is. Everybody can go get vaccinated and knows what they need to do. Given all of that, how do you think, what is the role health agencies play in combating that? And how much can we really expect them in terms of, succeeding in that work?
Really underscores the importance of leveraging trusted relationships, be it with your family doctor, which is why it's so important for all of us to have a family doctor, or whether it's with our public health units, who are reaching out and connecting to community leaders and community ambassadors, making sure that they're putting out information connected to the messages that are spreading in the community, whether they're related to misinformation, disinformation, or just questions about where people can get vaccinated, in multiple languages, using multiple different formats. But it requires a deliberate and intentional approach, a thoughtful approach. Slapping, a couple $100 behind an Instagram campaign with a very generic, albeit alliterative slogan is not going to cut the mustard.
So, before I hit record, we were talking about how, you were just talking about this case in your local community about the outreach that was done. So one, you actually have to do the outreach, but two, we find with, combating disinformation that trusted sources is like an interesting concept because it means different things to different people, right? Like, to some people, it's the government. And in the early days of the pandemic, we really saw that people said, okay, yeah, I'll roll up my sleeve, I'll get my 2 shots, etc. That, of course, has waned a little. But, there's trusted sources in terms of authority figures in government, but there's also trusted sources in terms of, your personal circle around you. And this is something that we've seen is that, you had just touched on this, that you can't really force people to go make these decisions. You have to sort of work on them from a friendly direction. How important do you think it is that we keep that sort of positive messaging to this kind of outreach?
We can, will, and should be able to get this outbreak under control, but it requires all of us stepping up and doing our part. To me, that is a positive message. It is an optimistic message that there is hope and that collectively as a community, we can look after ourselves and each other. That is the kind of messaging, I think that we need to be leading with. That is part of the kind of messaging that I consider to be health promotion. We have to avoid being paternalistic and fathoming all of the sort of doom and gloom scenarios. We have to I always believe we have to inspire people to work towards the right thing.
On this point of, disinformation and, perhaps some of the things that people believe, what kind of questions are you getting? Like, you're a doctor. I'm sure people come up to you and say, hey, I think this about measles. Is that true? Like, what are some of the other things you're hearing from people?
I think at the stage that we're in, I don't think that our public health messaging needs to be particularly complicated or sophisticated. A clear recommendation to get vaccinated, an articulation of our public health guidelines. Who should get it? When should they get it? Will it be covered? Yes, it will be covered. And that will take care of the lion's share. In any endeavor, the majority of work can be done with a relatively moderate amount of effort. And then it's clearing up the stragglers that requires in some cases, a dramatically increased and exponential amount of effort. But we can go from 70% to 85, 90%, I think, pretty easily.
So you were just talking about, health promotion, and something that requires is funding. So, when Doug Ford first took office, he very publicly slashed public health dollars. I think he took like $1 billion out of Toronto's public health funding alone. And those cuts to public health have continued in the, what is it now, 7 years he's been premier, including in the budget last year in 2024. Of course, we haven't had the new budget yet for this year. I think it's coming in a couple of weeks. But up until this most recent budget, they have been making cuts in this area. Can you talk about how that's impacted our ability as a province to actually, address some of these issues? And, is that maybe in some way also responsible for part of this outbreak?
It is, and it's interesting to be an observer and to listen during question period to to some of the statements that are made by the Ministry of Health, by the Minister of Health rather. One thing that I've been hearing a lot lately has been that this government has increased public health funding by 20%, which is a very convenient opinion. The reality is that after you have cut something by hundreds of millions of dollars, increasing the funding by 20% still leaves you far short of even where you were in the first place. And talking to
we saw this with ODSP when they first took office. It was supposed to increase by a certain amount. They cut it back down and then still called it an increase, even though it was actually a decrease functionally for people.
The other thing that we're seeing is that in some cases, funding may have been increased in certain programs, while other programs have just been eliminated altogether. Most recently, what we've seen is supposedly voluntary amalgamations of public health units, which really have not. It is felt a lot like they're amalgamations with the gun held towards these health units' heads, because they've been told if you want increased funding, you're going to have to amalgamate. And so, for example, under a circumstance like that, when you've got increasing centralization of power and centralization of a response, it takes away the local knowledge and experience for public health professionals that are very embedded in their community. It takes away from their nimbleness to respond to local outbreaks, to know their community really well. And it results in public health messaging and public health responses that are more generic, which are not helpful. And then, of course, as I mentioned earlier on, when public health units are forced to decide between doing catch-up vaccinations and dealing with the epidemic of drug poisonings, and they're struggling with people who are dropping dead at the doors to their offices, for example, it means making difficult choices that leave things like catch-up vaccinations behind. And when those catch-up vaccinations aren't getting done, it lays a foundation for exactly the kind of outbreak that we're seeing today.
I want to tack on to that because this leads to the question of knock-on effects with other policies. So, I guess it was last spring now. I don't know, I've lost track of time, but last spring, the Ford government had been pushing this idea that, we need to get rid of safe consumption sites. And they've moved a whole bunch on policies that, in my opinion, and the opinion of many actual experts and not just armchair people like myself, are actually detrimental to people's health in this area and will lead to deaths. You just mentioned how when public health is partly focused on that, it's pulling focus from other areas. So can you talk a little bit about some of the other policies this government has made in healthcare that are actually, spiking this problem?
Yeah, definitely. I mean, so underfunding writ large, we're seeing, multiple competing public health priorities. We've got the epidemic of drug poisoning. Now we have measles. We have the cancellation of wastewater surveillance, and we've seen, what happens when we don't have safe water testing. Right, Walkerton wasn't that long ago, and right. While we may not be looking at, struggling with that right now, that may not be, we may not have a Walkerton on our hands right now, but in the absence of appropriate lab testing and proactive measures, it may be around the corner. And so, the science table, which used to provide objective, unbiased, evidence-based knowledge and recommendations, supposedly has been folded into the Public Health Agency of Ontario, but we're not hearing from it anymore, and certainly it doesn't feel as though this government is implementing measures that a science table would be recommending. So these are a couple of the things that are either competing priorities for public health right now, or things that I wish were in place that are putting our province more at risk as we speak.
So speaking of wishes, now you're the critic for health, but you're also, as a thoughtful person, somebody who makes recommendations to the government as opposed to just criticizing it all the time. So what are some of the suggestions you've been making that, if you were in government, you'd be doing on this front?
So specifically on measles, I've given a 5-pillar, high altitude perspective on what we should be doing, and I provided some very concrete examples as well. The first thing is we do need to have a province-wide vaccine campaign. Other people are doing it. Alberta is working on something similar right now. That should be happening. We need to be, allocating the funding that public health units and the Public Health Ontario are asking for. So we need to be talking about it. I've outlined many of the policy measures that have led us to where we are today. Well, if it has been policy that has made us as vulnerable, we need to bring that back onto the legislative agenda and institute policies that elevate public health and enable it to do the work that it needs to do. We need regular updates. We shouldn't be waiting for months before the premier utters the word measles, or and have generic responses from the Minister of Health and the legislature. And then we do need to be focused on educating the public through health promotion campaigns. And those 5 pillars, vaccination, allocating funding, bringing progressive policy on the legislative agenda, updating the public, and educating the public, that's my bird's eye view. There are some very, very concrete things. I mentioned some of the things that Alberta is doing: a measles hotline, television campaign, public and mobile vaccination clinics. Those would be great. It wasn't that long ago that the Minister of Education sent a letter to every single child in daycare right before the election, fear-mongering about the fact that funding to $10 a day childcare could be eliminated. And what was left unsaid was $10 a day childcare could be eliminated if people voted for the wrong party. So he could do that to seemingly influence people's thoughts before an election. How about that same letter encouraging people to double check their child's vaccination status, or answering some basic questions about vaccines? So things like that, I think, could go a really long way, are very concrete examples of actions that this government could be taking. And of course, a meaningful advertising and health promotion campaign with television ads, exactly like we saw this government have no hesitancy in doing when they were trying to convince people that they were making life affordable to people. Even though I was like, no, I won't go down that path, but I'll leave it there.
It just makes me think about the whole stimulus, I will call it a bribery check campaign that they were doing, where they were sending money out to everybody. They mobilized very quickly for that, and they were very vocal about that. There's clearly an ability to do these things.
100%.
Just a question of will. So before we go here, as a former fundraiser myself, I always think about calls to action, and this is an issue that's broader than just measles. It's about pushing back against disinformation in general, and advocating for stronger public health. So what is your advice to the people out there listening to this in terms of what they can do to help fight disinformation, but also advocate for stronger public health protections in general in Ontario?
So, you know what? I have a couple thoughts and a couple different ones. My first is we all need to make sure that as many of us are vaccinated. We're not going to get there by wagging our finger at people or by being judgmental. But we can have conversations with trusted friends, colleagues, and family members about how we feel about measles, about the importance of vaccination, again, in a non-judgmental way, and make it something that we're not afraid to talk about. I think that's something that anyone and everyone can do, and it doesn't have to be controversial. The majority of people will be, I'm convinced, will be quite receptive about that. As for, and then we can all push our local elected officials, no matter what party they are, to stand up for a stronger, robust public health care system and public health system. That can happen in any of a number of ways: petitions, form letters, emails, or personally written letters to your local member, and having meetings. We are now seeing more people, posting about their experience getting vaccinated. We saw a lot of that during COVID-19, and we can do more of that. As people are getting vaccinated for the measles, for the MMR vaccine. And I think just pushing our leaders to say more and having non-judgmental conversations with each other, I think really can take us a really long way towards building trust and working our way out of this outbreak.
There's nothing else, people can call Doug Ford's cell phone and give him a chat about this.
The Premier's office number is 416-325-1941.
Well, there you go. Perfect note to end on. Thanks for joining me today.
Of course, it's absolutely my pleasure. Thanks for having me.
You've been listening to Progress Canada, presented by Lightbulb Narrative, a Canadian communications company specializing in content creation, narrative development, and strategic communications. Our music was composed by Elliot Middleton. If you enjoyed today's episode, please consider subscribing to access future episodes the moment they drop. Thanks for listening.